Welcome. I'm Laura Piquette. I am the chair of the HIT, or Health Information and Informatics area. Laurie and I were just having a discussion about that name. First of all, I want to let you know that our segment is being recorded. The college asked that we do that so that we will have it. As we go through the program, if there's any questions that you may have, you can put them in to the chat and Lori will monitor them, or you can write them down and wait till the end and we can discuss them then. I hope you have a lot of questions because this is a really, really exciting program, the best one in the school. So again, I'm Laura Piquette. I am an RHIA, which is a registered health information administrator. And I started in an associate's program such as what we have to offer at STIC. So I'm going to jump into a PowerPoint and show you what we have to offer in this area. So I'm going to share my screen. Can you all see it? Thumbs up, yeah? Cool. All right. So again, health information technology and medical coding and billing specialists. These are two areas that I'm going to discuss with you and hope to get you interested enough to check them out. First, we're going to discuss the HIT program, okay, the Health Information Technology Program. So what is it exactly? I can tell you that I can't even in this one sitting talk about all the things that you could do with this degree. There is a variety of jobs, and one of the PowerPoints will list them, but it's really an amazing career. We have to understand healthcare information, right? That documentation. We have to know rules and laws that our government puts in place to standardize certain healthcare standards so that we're not committing fraud. And I know that's a big topic in today's world, healthcare fraud, especially with what's going on now. So this is all that's involved within HIT. And it starts with, you know, just coming in at an entry level and working your way up into an associate's degree. So our program for the and again, here's the health informatics and information management. We are accredited by CAHIM, or the Commission on Accreditation for Health Informatics and Information Management. I think that's where we get that title. But CAHIM, really, they put us through the ringer. They examined us with a microscope to make sure that our program is providing quality education. So you can rest assured that if you come into this associate's program, you're going to get what you need to sit for your RHIT credential, or Registered Health Information Management Technology credential. Again, this job has so many opportunities. It's truly amazing. And we're going to discuss some of those. But is it right for you? Okay. If you're interested in healthcare, you know it. I loved healthcare, but I didn't want to work with patients. And that's the first bullet point, right? So is it right for you? Well, again, if you love healthcare, you like science, but not sick people, this is where you want to be. If you want an area, you get one degree and it opens up multiple opportunities for you, right? This is the degree for you. You like science, management, right? It brings it all together with this one degree. as a HIM professional, you are working alongside all healthcare professionals. You're going to be working side by side with physicians, maybe even lucky enough to train them on documentation. That's interesting. You're going to be working with nurses, and depending on where you work, I've worked with lawyers, district attorneys, insurance companies. So there's so much out there with this degree. With this degree, you have a choice of working in an office with others, or depending on the position you take, you'd be working at home, right? If you go into coding, record processing, transcription, you're going to be working from home in these areas. So again, this profession opens up so much for you. So let's take a look at some of the jobs. Right? This is some of the places you could work at. And it isn't just healthcare. You see healthcare, the ambulatory surgery, behavioral health, long-term care, but then it starts going into health information exchange, right? The regional extension center, because now our jobs are sort of changing, going into that technology portion, and they're looking for people to help work in this area. So I've had people work in attorneys' offices, insurance companies. You can work in government. You can get a job with the Centers for Medicare and Medicaid, right? So there's so much out there with this one degree. It's a really exciting career. And it's all well and good that we can do these different things, but you know, the first thing a lot of people say, well, what about the income, right? Is it worth it? So our income fluctuates. Again, depending on where you live, it's going to change. But with an associate's degree as an HIT, you are going to have an entry-level position anywhere from $40,000 to $60,000. Okay, so that is your base. That's a starting, but you're going to work your way up. If you have an HIT degree, believe me, you're going to be involved in a lot of things that you're going to want to go in higher. You're going to go into supervisory or management. And I added this second bullet point about a master's degree. And I put the master's before the bachelor's because AHIMA, which is our organization for health information, it is the American Health Information Management Association. They have this big push. They're very into education, and they really want the HIT professional to continue their education. Okay, so the good thing is within HIT, there's a bachelor's degree, okay, and there's a master's degree. I received my bachelor's in health information management, and I sat for my RHIA. But when I went for my master's, I wanted something different. And I didn't go with health information because it was more technology, and I wanted the business portion, the management portion. So I went health administration, healthcare administration. But that master's degree and that bachelor's degree, you can really earn some good money out there, right? But again, it's going to come with your experience, what you get into, and that degree, because we all know a degree means a lot. So how would you get into our program, this program? There's a couple things that you do have to be able to do. It is a high functioning position where unfortunately we're doing statistics. There's just a little bit of math. So you do need some algebra or math 087. So again, you would look at high school or maybe previous college math, or maybe take a math placement exam to see where you are entering at. You have to be able to type something, 30 words a minute. I know it sounds like a lot, but it isn't, but you need accuracy. A lot of what we do is computerized, so accuracy is important. You have to have a GPA or grade point average of a 2.0. But again, as you're going through the program, it's important that you continue to maintain a C, a minimum of a C in your classes, or students can be removed. But we strongly recommend before applying that you take medical terminology, which is Med 100, and computer basics, CMP 106. The Med 100, you need medical terminology for this program. Part of it is coding. And if you don't know the difference between your ectomies and your otomies in healthcare, you could code the wrong thing. So it's very important. And we do have, like I said, it is an application process, and we do accept them twice a year. We will be accepting them through November 30th if you're planning on starting in January, or March 31st for a September entry. Again, this position, HIT, there's many jobs out there for this. There are coding, supervisor, management, tumor registry, record processing, release of information, birth certificate clerk. I can name so many. The great thing is we have a very good placement rate here. We just had a recent graduate before he even left. He was hired as a tumor registrar at Bay State. We have people hired for coding. So we have the positions here. We just need the qualified people. So if you're interested in this program, I would be so excited, and I'd love to meet with you to talk more about it. But it's not our only program. Okay, that's our HIT program. We also have our coding program, and we have the associates and a certificate. Medical coding, though, let's talk a little bit about that. Okay, because a lot of people, they have an idea, but I want to make sure we're clear. So I like to use a couple metaphors to compare what coding is. In this one, I like to say, you know how a musician can read music, and they take that tool or that instrument to produce what is written on that piece of paper. In medical coding, what we do is we take all the information the doctor reads or documents, doesn't matter, anatomy, physiology in a surgical report, right? That medical terminology, we have to understand it. We have to take that information, use our tools, which may be our coding books, right? Our knowledge, and we produce something that helps healthcare organizations, and that's to get money. That's what a code does. They are the ones who are taking that service, right? And then applying all the rules of our government and third-party payers, and we're producing a code that will go on the bill, and the doctor gets paid that way. We're using our interpreter skills, just like a musician does. What do they do? What does a coder really do? So think about every time you walk in your doctor's office for a physical, or maybe you have a sore throat. Every time you walk in to have a lab on or an x-ray, that is what a medical coder takes. They are going to look at that documentation that the doctor will look at. So you come in for a sore throat, your doctor is going to document, patient has sore throat, but he's going to add other things to it, maybe assessment. You know, is the neck rigid? Is there pain? And he's going to what is with you, what he's going to do with it. That is medical documentation. That's how the doctor gets paid, is his quality documentation. Because then we take that, we read it and we decipher it and we assign a code. Depends on what you're coding, whether it's a procedure or diagnosis, and it's going to go on the bill. And that's what's going to drive what the doctor gets paid. Okay, so if he does not document correctly, he's not going to get the right code. We're going to code it incorrectly, but it's not a coder's fault. So there's a lot of give and take there. It's an amazing, it doesn't sound fun, but it is, because you're working with that doctor, training him on the proper documentation to get that correct code, to get the correct reimbursement. Okay, so we take that documentation and we use it. So when we get that documentation, we are going to look at the patient's diagnosis. We're going to look at what was done. Were there x-rays, labs, whatever. We're going to look at, were there other unusual circumstances? Maybe the patient came in for asthma and has congestive heart failure, right? So we have to know this stuff. We have to understand it and put it all together and provide codes. But it isn't just reimbursement. We really truly code for statistical purposes. We're the ones who the World Health Organization or the Centers for Disease Control come to when they need to do research. They're using our information. So it's really cool that we are that important in this job. So how do you become a medical coder? Well, first of all, they don't hire people right off the street. That was the good old days, maybe 30 years ago. Now you have to be a trained medical coder. You have to go to a qualified school. And once you finish schooling, you want to sit for your coding credential. There are not very many healthcare organizations that will hire somebody without a coding credential. And again, this credential is put out through AHIMA, which is the same organization for the RHIT. Okay, but for coding, they are not, AHIMA is not the only organization, as you'll see coming up. But being a coder is a really good position, because right now, healthcare is always changing. It's the kind of profession that needs very knowledgeable, tech savvy people to code, right? Technology is getting really crazy. The codes are changing, and we need those qualified people to do the job. I just read an article recently that there's going to be a lot of coders retiring. Well, we just went through a large retirement when ICD-10, it's a coding system, came into place, because the older coders didn't want to learn it. They retired. Now we're getting to the point where my group of cohorts, we're going to be retiring in the next 2-3 years. So we need more professional coders, okay? The job is in high demand. Google it. Look at medical coders. There are jobs from coast to coast. It's a very, very high demand job. So when we put you through our program, and inpatient are two different things. So you will learn it, and then you are going to have to figure out which one you want to specialize in, right? But you'll be able to work in a hospital, doctor's office, an insurance company, an attorney's office. Because guess what, you get those fender benders, and the attorney wants those copies of medical records. He needs the codes, so he hires coders. So just saying. And we will prepare you to sit for that CCA exam. And here we mentioned the CPC exam with AAPC. Lots of letters, lots of abbreviations, I know. But the CPC is a certified physician's coder. They code outpatient. They would be in a doctor's office, or maybe an ambulatory surgery office. So there's a lot that you can do as a coder. Again, not as much as an RHIT, but a coder, you can work in many, many different places. As long as you have that schooling, and then eventually your credential. So again, let's talk a little bit about the salary, okay? It's hard to talk about salary when we talk about medical coders, because again, like I said, it's going to depend on the type of coding you do. If you're an inpatient coder, you are going to make good money, all right? But that takes time and lots of learning, okay? Inpatient's very complicated. So if you are in California compared to Massachusetts, that geographic location is going to be different too. All right, that's going to depend on what you make. And of course, the more credentials you have, the more you're going to make. So I have an example here. An inpatient coder in Western Mass, our area, can start at $25 an hour as an inpatient coder. But if they're going to Boston, you're going to make a lot more money in Boston. It's just the nature of the game. Again, you can move to another state, and in one area of the state, you're going to make more than the other. It's the way it is. Even, and I won't name names, but if you worked in one of the smaller area hospitals that isn't connected to a bigger hospital, you will not make as much money as you would in that hospital that owns like tons of other hospitals, right? They can give you more money. So it all depends, but this average starting salary of a coder right out of school is $44,000 to $50,000. Right. And then again, you're going to start at that salary, but you're going to continue your education and your coding career, and it's going to go up fast. Okay. And you always want to strive to move up that ladder. And a lot of places will offer you that ladder. Well, if you start at a CCA and you go and you get your CCS, which is another credential, we'll give you $2 more an hour. A lot of facilities do that. When I was the director, I did that for my coders in hopes of getting those credentialed coders. And it works, right? Because we need money. We want to live good lives. So what do we do to apply to this program? So again, we have an associate's degree and we have that certificate of completion. So both of them are about the same. You know, we want to see that high school English with a C or better. The associate's degree is going to require more courses, of course, than the certificate. And you'll have to take those Englishes in the associate's degree. But the certificate is just 2 semesters. And it's going to give you that basic coding skill. Okay. The associates is going to be more robust. It's going to have more classes than the other, but you're still going to be able to code with that that first one. I'm sorry, I'm choking. So we want to make sure that you have some algebra. I know it doesn't sound fun, but again, we do some statistics in our classes and you do need to know it. And then there's that medical terminology. And you have to have a C or better. If you get a C minus, you have to repeat it to be in the program. Okay. So does anybody have any questions about either or any of our programs, because there's really 3, we sort of mix 2 in. Go ahead. Oh, you're muted. You're muted.
Hi. I'm sorry about all the interruptions. My son is homeschooling, and he started today, so it's been a doozy. So thank you. I kind of missed a lot of it, but I kind of heard you say that we can meet and discuss further.
Oh yes.
Interest. How are you guys working that out with everything that's going on?
So are you a current student?
No, I'm not.
No? Okay. So my stick email is right there, lpket@stick.edu.
Mm-hmm.
Use that, send me an email and let me know that you sat through our open house, and I can set up a, I'll send you a link for a meeting.
Okay.
Definitely.
Okay. Thank you.
I know
so much.
this is like an overview, and I know you were really busy.
I'm so sorry.
No.
But I'll email you. I'm gonna email you, and then you can let me know at your convenience.
That's perfect.
Okay.
Have no problem with that.
Thank you.
You're welcome. You're welcome.
Laura, we had another question come in via the chat.
Mm-hmm.
And the question is, can I apply for financial aid to cover their certificate program?
Yes. Yes, I have students. Yes, it's a college certificate, so taking college courses just like anything else. So I guess you would need to talk to financial aid, because I'm not going to get into FAFSAs and all that. I'm not good at that. I've done them before, and that's all I want to know. But yeah, you want to and get going on that. Any other questions? So I do want to mention before we leave, there is another open house on December 8th. I think that's at 4 o'clock. I'm sorry. Yes, at 4. Look for flyers for that. Maybe get word out so that maybe has some friends and family that interested in it. But I thank you for your time. I thank you for coming in and asking about this program. Again, if I had 2 hours, I could sit here and just go on and on about our programs. And it's because the career is amazing. You would never be disappointed in this career if you chose it. It's just amazing the opportunities that exist at any level. So, and across the nation, you get your credentials in Massachusetts, you move to California, your credentials go with you. Okay, so somebody has.
Someone has their hand raised.
Shondell.
Shondell, do you have
Hi.
a question you'd like to ask?
Yes, I'm in the certificate program for the medical billing and coding. I start in January. Now, my question is, will I be able to get a job right out of having my certificate program? Because I'm hearing, like, from different people, you need 2-3 years experience, and other people are saying, you can get a job right out of having your certificate. So I was just curious as to, well, is it going to be hard for me to get a job?
Like any other career or position, you have to really go out and sell yourself. Okay, you need that resume, and if there's a job that says 2-3 years experience required,
yeah, don't apply.
Jump on it and apply, because guess what? In this area, there are no qualified people. The
Okay,
recruiters and people who are qualified, they're staying in their job. They're not going to give their jobs up, right?
okay,
We have had students leave our certificate and have positions.
okay,
But we've also had some who didn't get a position, but they didn't try hard enough. They didn't do that resume. They didn't give their all. And it's a
okay,
competitive world, right? And we have to do that. And I teach that as part of my classes. It's getting it's getting that self-assurance as an HIT, a coder, and being able to put yourself out there and say, I know my stuff. And
okay,
here's what I know, and I'm learning more. I've had coders get jobs without their credentials because they told them, yeah, I just got out of school and I am scheduled to take my credential on this day. Fine, right?
okay,
They'll say, we're going to hire you with the caveat that you get your credential in 18 months. They'll do
okay,
that too.
okay,
Always tell students, never hesitate to apply for a position that says you need this many years experience. Never.
okay. Now, is it better to have your associate's degree? I'm starting with the certificate to get all of those out of the way, so I wasn't sure, would it benefit me to go back and just get my associates?
I'm going to say yes, only because there's more courses. You're going to get introduction to health information management. You're going to be taking classes that you're going to know more about health information that will help you in coding than the
Okay,
certificate. Okay.
okay,
And again, I have students who do the certificate, they get that certificate, and then they go into the associates and they finish the associates. But in the meantime, they're coding for a job,
okay, okay.
right?
Now,
So you can do that.
does stick help with getting jobs?
What we do is we have connections that will email us when jobs open up, and when we have people who are getting ready to graduate, we send that first to them because they're graduating, and then it trickles to the other students. We share. But a lot of our, so if you do the associates, you have to do an internship.
Yeah.
So in other words, you're going to have to go somewheres and not work because you don't get paid for it, but you have
Yeah.
to put in 140 hours, right?
Okay,
And you're going to learn everything. I have 3 people in their internships right now. 2 just got hired by the people, the internships.
okay, okay,
So the opportunities there, it's up to the student to really sell yourself, to get out there and, here's my resume and it looks better than everybody else's, right?
okay,
And we
okay,
go through that. We go through that in classes, right? So again, when you take that certificate, you're getting the basics. You'll be able to code, definitely. But if you go with the associates, there's more. You're going to have a class called Health Office Basics. And it's to go through all the different things that you need to know about health offices, things like that. So it's going to add to that.
okay.
And then again, I have students who are in the associates for coding, and I sort of push them to the HIT program. So I'm never satisfied. I'm always going to push you, but that's me. Because I just love this career so much. I really do. So I want as many people as possible to fall in love with it and do it too.
Okay, all right, thank you
Okay.
so much.
You're more than welcome. I look forward to having you in class.